Hi, my name is Savitha Raman. I'm the principal dentist at SR Dental Care in Dalkeith. I'm going to talk about caring for your oral health during a lockdown situation like this. Just before we start, just a quick update on what's happening in the dental practice. Up until 2 weeks ago, we've been treating patients. Initially, we've been given like a public guideline saying that we need to reduce aerosol generating procedures, and which later on they said we need to stop aerosol generating procedures, and that's the reason why we had to close down the practice. But we are very much available for phone triage during the working hours, and we are trying to do as much as we can. What's aerosol generating procedures in dentistry? Most of the things that we do, it involve using air turbine, which creates aerosol. When we use like high speed or a slow speed or even like an ultrasonic, it creates an aerosol which lingers in the air for a couple of hours, and that can that poses the problem with COVID-19. There is risk of transmission to the patients and then to the staff and to the dentist as well. That's the reason why we've been advised to stop doing aerosol generating procedures. And coming to caring for your oral health, the first one would be to brush twice a day using a fluoridated toothpaste. And I would definitely stress on brushing more at night time, because we're all in a lockdown, we're all working from home, kids are staying at home. At night time, people are watching telly, you just want to have like an after meal dessert or something, and then you're watching telly, you just fall asleep. If you have not brushed, that sugar is actually creating a lot of acid attack to your teeth, and at night time your body is actually shutting down, so there is less saliva, and saliva actually protects your teeth. So if there is going to be less saliva and if there is going to be acid attack, that's what causes decay. That's why I would stress brushing at night times and brushing in the morning as well, and using an interdental cleaning aids like floss or interdental brushes like TP brushes, or floss picks, or you can use like a water pick. Water pick is nothing but like a power spray. What I would describe to my patients is it's like a power spray which we use to clean tiles. Is something similar for teeth, but we have seen very good results with it, so it's quite effective, so it's worth a try. And then I would definitely recommend brushing your tongue, because the evidence and studies that's available out there are showing there is actually more bacteria in the tongue compared to your teeth and gums. So definitely brush your tongue. You can use a tongue cleaner, or you can use the back of your brush, which is a bit serrated, and you can try and remove all the bacteria from your tongue. And then using a mouthwash. There is a lot of brands out there, so I'm not going to name any, but I would definitely suggest using a fluoridated mouthwash, alcohol-free possibly. And then when I was on call, I've had few patients saying that their gums have been bleeding, and then they said, "Oh, can I use a corsetal mouthwash?" I would say the answer is yes and a no, because yes, during acute gum conditions, then you can use corsetal, it kind of helps. But if you're going to use it regularly, sometimes it can stain your teeth and it can alter your taste sensation as well. So I wouldn't want to use it like a regular mouthwash. But for certain gum conditions, certain gum inflammation, we can certainly guide you on that. So that's that. And last but not the least, coming to your diet. I know it's very hard. We're all in a lockdown. Everybody's working from home, and the kids staying at home. It's hard. I've got kids at home, and my son is constantly in the kitchen looking out for snacks, looking out for biscuit, chocolates, and things like that. So what I have said is, restrict sweet stuff or dessert to meal time rather than as a snack, because it's a number of times you have sweet stuff, and and then there is more and more acid attack, and that's what causes the decay. So say if you want to have a dessert, just have it after your meal time rather than as a snack. So during snack times, I would suggest, if for example, in my son's case, he would want to have a chocolate biscuit, so I would say, instead of that, swap it for a rice cake, or like a banana, apple, or carrot, or something like that, and then bribe him for a treat after the meal, and then of course brushing at night time as well. So you have to set that limit and try and cut down on sugar as much as possible, and that should help caring for your teeth and gums. And then once we are up and running, we'll get in touch to arrange for your checkups and pending treatments, which we don't know when, but hopefully soon. But up until then, try and keep safe and stay healthy. Thank you.